Welcome to the CSR TV Kochi 2016. I am glad to have with me Dr. KK Sethi sir. Welcome sir to the studio. Sir is the past president of Cardiology Society of India and is the chairman for Delhi Heart and Lung Institute, New Delhi. So I welcome you sir for this talk on this live TV. So to begin with, may I ask you, sir, how is the incidence of stroke and embolism worldwide and atrial fibrillation, how it differs from Asian to non-Asian, sir?
This is a very interesting fact that we must understand. The absolute prevalence of atrial fibrillation in Asians is less than what we have seen in the Western countries. Because primarily atrial fibrillation, and when we talk about atrial fibrillation in this particular context today, we are talking about non-valvular atrial fibrillation, which is not related to valvular heart disease like rheumatic heart disease, etc. And primarily that is a disease of the elderly. Now, with increasing life expectancy in all Asian countries, we see large number of elderly people, and that number is likely to increase. So in fact, it has been projected that by the year 2050, the number of patients with atrial fibrillation in Asia will be more than the entire United States and Europe put together. And therefore, we have a huge problem at hand because the Asians have a much higher incidence of stroke with atrial fibrillation. Even though they have same Chad's-Vasc score or the same risk factors for stroke as the non-Asians have. And they also have more incidence of bleeding when they take anticoagulants as compared to non-Asians. So it is therefore very important that adequate strategies for stroke prevention be put in place so that this very serious and disabling disease can be reduced in its incidence and prevalence.